future of healthcare in South Australia is here. Care Connect SA, linking healthcare professionals through one central point of access to high-quality patient information.
Care Connect SA is working towards delivery of an integrated public sector electronic health record across all of South Australia. A major part of this program is the introduction of a new information system, clinical practice support. More than 14,000 nurses, midwives and other clinical professionals in South Australia will use clinical practice support to assist in decision making about patient care. Really, this is just one component of the Care Connect SA vision, which is aimed at bringing a multidisciplinary approach to enhance patient care.
Care Connect SA Clinical Practice Support, an online decision support tool developed by nurses and midwives and promoting quality patient care outcomes based on best available evidence-based practice.
This is an exciting time for nurses and midwives across South Australia. The challenge of implementing a standardised statewide system has given us the opportunity for consistency of practice. One of the aims of clinical practice support is to give the nurses and midwives more time to spend with their patients. It will also give them the ability to streamline daily assessment, intervention and care planning processes that occur normally between them and their patients. Clinical practice support assists in the management of clinical work, identifying risk strategies and monitoring patient outcomes. As with all healthcare journeys, this is all about teamwork. It's about all of us working together and being part of this important journey.
Care Connect SA Clinical Practice Support will assist those healthcare professionals involved in adult, paediatric, maternity, mental health and rehabilitation care in 16 hospitals around the state, including Country SA. Clinical Practice Support confirms the patient's position at the centre of care, linking episodes of care and ensuring continuity in addressing patient needs.
An advantage for us is the fact that clinical practice support will bring all elements of patient care planning together. An advantage for me is the fact that wherever I work in another public hospital, nothing changes. Clinical practice support is the same wherever I go.
How does Care Connect SA Clinical Practice Support work in a real-life healthcare situation? We take you to the Port Augusta Hospital, where 2-year-old Charlie has just been brought in by his worried mum.
Yeah, Charlie's chest does sound quite noisy and his temperature's 39.2. Has he experienced this level of distress before?
He has actually. We were in line with you in hospital about 6 months ago, similar sort of thing. And he was on regular nebulisers and also on prednisolone. He was quite unwell.
Okay. Well, once we get Charlie admitted, then we can look at his previous nursing history and no doubt we'll have to update his care plan because I'm sure he's much more active than he was 6 months ago.
Definitely.
All right. I'll just grab some further details about Charlie.
This is where clinical practice support comes into its own. Nurses and midwives will have more opportunity to engage with their patients at point of care using digital technology.
Doctor's here now. I'll get him to review Charlie's condition for you.
Okay, thank you.
G'day, I'm Dr. All.
Hi, Dr. All.
So Charlie's asthma's playing up?
Yes.
Oh, okay, I just need to have a listen to his chest to see how bad it is.
Sit up, Charlie.
Just going to have a listen, Charlie? All right. Thank you.
The doctor examines Charlie and decides to admit him to the ward.
Hi Danny, my name is Rebecca. I'm the nurse who will be looking after Charlie today. So we're going to do some information taken based on Charlie's background.
And while Charlie receives patient care, the nurse starts his admission process, including running mum through a paediatric assessment. By next morning, Charlie's condition has deteriorated and the hospital's paediatric doctor makes a carefully considered decision after seeing him.
So Mrs. Thompson, as you know, he's needed a lot of treatment overnight. He actually hasn't got a lot better.
No.
Okay. And assessing him this morning and talking to my colleagues at the Women's and Children's Hospital, I think he should go down to the Women's and Children's Hospital for assessment and treatment.
Okay.
We'll organise that for you with the Royal Flying Doctor Service, and their doctors and nurses will look after you.
So he's going to be okay?
He's going to be perfectly fine.
A trip with the ambulance service to the airport, and Charlie and his mum are delivered into the capable hands of the Royal Flying Doctor Service nurse and pilot for the flight to Adelaide.
Hi, I'm Christina. I'm the registered nurse who's responsible for looking after Charlie today.
Hi, Christina.
Hi. Once we get you settled into the ward, I thought we'd actually go through some of the assessments. Now that Charlie's been admitted, we can actually review his previous assessments. They shouldn't have changed too much because we can get the information from his last admission to hospital.
Oh good, that'll make it easier.
March.
Another great benefit of clinical practice support is the clever design to streamline information and minimise duplicated data entry. That means that nurses and midwives can spend more time undertaking their patient care activities. A few days in the Women's and Children's Hospital and Charlie is on his way home.
Well, good luck, Charlie, and have a good trip home.
Thank you.
See you, Danny.
Charlie, wave goodbye. Bye. Good boy.
Clinical practice support assists nurses and midwives to provide their patients with the most appropriate treatment and care across the South Australian health system. Improving the quality, security and efficiency of healthcare is the key objective of those who work at the frontline. Care Connect SA's objective is to tie clinical information together via a single electronic health record. That means any time a patient is admitted to a public hospital in the future, their history will be available. The end result will be the provision of well-informed and continuous patient care.